Hi guys, welcome back to my channel, and in today's video we're going to be talking about hyperpigmentation, types, causes, treatment, the anatomy of the skin, all that. Okay, I know it's been so long since I didn't upload a video, but here we are again starting this journey, so let's get into it. But before that, please like, share and subscribe, and don't forget to press the bell icon for engagement. Now, there are different kinds of hyperpigmentation. The common ones that we seem to know is post-inflammatory erythema, PIE, mainly seen in paler people. So when somebody gets pimples or acne, the red spots that are left behind are post-inflammatory erythema. PIH, post-inflammatory hyperpigmentation. So these are spots that are also left after acne, but mainly seen in people of color or darker skin tone people. Similar mechanism of action. Then we have suntan. We all know what suntan is. And then we have melasma. Melasma is basically bilateral pigmentation of skin. It is also known as mask of pregnancy because it is usually seen during pregnancy and is prevalent in women. Well, it's because your hormones are all over the place. So like, your melanocytes get active and they release a lot of pigments. And sadly, research have shown that it is seen in women of Asian descent. But that doesn't cross out the fact that it won't happen in other people, that there is a very high chance that it might also happen in other people and can be seen in other people in general. I'm literally freestyling this whole script. I've written some points here, so I'm gonna look down. But before we get into the treatment and causes and all of that, let's talk about the anatomy of the skin. So anatomy, the skin has three layers: epidermis, dermis, and hypodermis. Epidermis, dermis, and hypodermis. Let's keep the hypodermis outside for a moment. Let's talk about epidermis and dermis. So epidermis is the topmost layer, then we have the dermis. Now, epidermis and dermis is divided by another layer called the basal cell layer. Basal cell layer is the layer where new skin cells are produced. So when skin cell turnover happens, that is 28 days ideally, what happens is that the skin cells are pushed up on the top layer of the skin, and then the older cells die, and these are the dead skin cells that we generally know, and that forms the stratum corneum of our skin. Okay, basal cell layer has something called melanocytes, melanin producing cells, and there is a production of melanin with the help of an enzyme called tyrosinase. Why am I telling you about this? Tyrosinase, melanocytes, melanin, blah blah blah, because I will tell you three ways in which we can treat hyperpigmentation. Oh my god, I can't speak English. Anyway, causes. No SPF. Number 1, high amount of sun exposure. Number 3, inflammation. 4, pregnancy, because hormones are all over the place. Number 5 is contraception, hormone replacement therapy, all of that, because again, your hormones are gonna be all over the place once again. And yeah, so it's a lesser known side effects because nobody talks about it. But then yeah, like when you're on a hormone replacement therapy or contraceptive pill, you are more prone to hyperpigmentation than anybody else who is not in that particular treatment. And then we have other things like using your products wrong, for example, buying tretinoin off prescription without a doctor's supervision, or hydroquinone, and causing darkening of the skin, etc. So there are 3 ways of treating hyperpigmentation, right? First is by blocking tyrosinase. So like I said, enzyme tyrosinase acts on melanocyte and melanin is increased, right? Melanin is produced. If we block tyrosinase, melanin will not be produced. So that is one way. Now let's say you could not block your tyrosinase and melanin is produced. There is something, a car, that will take it to the layer on the top layer of your skin, so that we're able to see it physically. So that car, we need to break that car down, okay? We need to break the melanosome down. Now, breaking that car is the second point. So the third way is by increasing skin cell turnover. Most of the times my client contact me at this stage. They're like, oh my god, doctor, I have PIH, I have PIE, I have melasma. What am I going to do? Well, we're going to increase your skin cell turnover. Now, how are we going to do that? It's by using products that do that, right? Clearly, we're not able to block your tyrosinase. You were not able to break the car down, melanosome, which is totally okay. which is okay. So now we're gonna be working on increasing your skin cell turnover. I keep looking at myself and I'm like, oh, and I forget the script. Let's talk about the products. The first one is the tyrosinase inhibitor, right? We're blocking the tyrosinase, so we're calling it inhibiting the tyrosinase, so we call it tyrosinase inhibitors. Get your pen and paper. I'm waiting for you. 1, 2, 3, 4, 5. Done. I'm not waiting for you anymore. So we have retinol, we have vitamin C, we have azelaic acid, we have kojic acid, and we have alpha arbutin. Retinol, retinoids. Keep that in mind because I'm gonna come back to it later after all the 3 points are done. Most of the ingredients here are antioxidants, which means that you can apply it in the morning. And what does antioxidant do? It prevents free radical damage and pushes your SPF to work a little harder. Point number 2. Breaking the car down, breaking the melanosome. Retinoid, niacinamide. Again, retinoid, keep that in mind. Number 3, increasing skin cell turnover. After the pigment has been released, we have AHA, alpha hydroxy acid, BHA, beta hydroxy acid, and we have retinoid. Again, if you've noticed one thing, retinoid is in each and every section, which means that retinoid can inhibit tyrosinase, retinoid can break the car down, retinoid can increase skin cell turnover, which means that you're going to want to use retinoid at night once a week and then build it up. And when I say retinoid, I mean retinol. You're not going to tretinoin. Tretinoid is not a skin care product. It is a medication. Comes with prescription only. Then also include your AHA and BHAs on the other days. Again, if you have oily skin, you want to use salicylic acid. If you have normal, dry, dehydrated combination skin, go for lactic acid. If you have dry and acne prone, again lactic acid. If you have sensitive skin, go for something like malic acid, because big molecules, so it just sits on the top of your skin and gently exfoliates it. Extra tips. Use tinted sunscreens. Why? Because it has iron oxide. Iron oxide blocks visible lights. Normal sunscreens only block UVA, UVB, and I'm not saying that normal sunscreens are bad. They're amazing. I use a normal sunscreen most of the time. But tinted sunscreen blocks extra thing called visible lights. Now, visible light are lights that you can see. For example, this yellow light. Can you see that? I can see that. It's a visible light. Again, phone, laptops also have visible lights, but that does not really cause a lot of damage. But again, if you're somebody who is prone to hyperpigmentation, why not protect yourself from that as well, right? Number 2 is treat the underlying cause. If you have acne, go to the doctor. Figure out what's the underlying cause of that acne. If you have, let's say, perioral hyperpigmentation around the mouth, or dark circles, go to the doctor. Get your blood work done. Figure out if you have B12 or vitamin D deficiency, or any other deficiency for that matter, and treat it. And that way, you can figure out the underlying cause. If you have melasma, for example, of course, for melasma, you need to figure out your hormones if you're not pregnant. And if you are pregnant, then wait for this amazing time to, end. And then you can start your another amazing journey of using retinoids. So, one point that I actually forgot to add, and I just remembered when I was sitting and editing this video, is do not use hydroquinone and tretinoin without your doctor's permission. Tretinoin and hydroquinone should not be used without a doctor's prescription. Tretinoin and hydroquinone should be used under a doctor's supervision only. I said it thrice, and even if you're still gonna go and get hydroquinone and tretinoin, I quit. Hydroquinone is such a potent ingredient that it literally disrupts the anatomy of the skin. I can't even explain it better. It causes leathering of the skin. It causes permanent darkness of the skin, darkening of the skin, and it just makes it so bad that no kind of cosmetic treatment or skincare can reverse it. Tretinoin causes broken blood vessels, which cannot be reversed and the side effects are not limited to just dryness, flakiness, redness, and all that. There's so many things that could go wrong. So please use these 2 ingredients under a doctor's supervision only. And here's your 4th time. Anyway, this was it. If you still have questions, comment down below or message me on my Instagram, and I will see you on my next video. Adios, amigo. Powering off. Bye.